In this video, we will go over the most common mistakes we see people make when performing a 90-90 hip lift from the Postural Restoration Institute. The 90-90 hip lift is an extremely effective technique. When it's done well, this technique can position your pelvis and your rib cage into a better position from which we can breathe and stabilize ourselves much more efficiently. A lot of people tend to get stuck in an overly extended position, so pelvis tipped forward, rib cage flared. That can happen on one or on both sides of the body. And this position really is representative of a costly or inefficient breathing strategy and stability strategy. I say costly because the back and the neck and the hip flexors in that position will work overtime in order to really just manage life, managing gravity, managing breathing. When we are in an extended position, the ribs are flaring out. The diaphragm, either on one or on both sides, will sit very low. And what that means is if it's sitting chronically in a low position, it cannot do its job as the primary breathing muscle. So one of the main goals in a 90-90 hip lift is to learn how to truly exhale as to get the diaphragm to move up, to ascend, teach our obliques to keep the ribs down so that then we can inhale with the diaphragm pulling the air in and not the neck. The primary muscle groups that you'll feel when you're doing the 90-90 hip lift correctly are the hamstrings, the lower abdominals, and the side of your abdominals. So your transverse abdominals and your internal obliques. There are, however, many possible sources of mistakes that can render the technique ineffective. In this video, I'm going to categorize them into 4 different categories. Number 1, setup mistakes. Number 2, mistakes that are related to the action of tilting the pelvis. Number 3, inhalation related mistakes. And number 4, exhalation related mistakes. So let's go over them. Setup mistakes. The first one I want to address here is the topic of head support. There are issues that can arise when we do not have head support and we actually need it. And there are issues that can arise when we have too much of it. When you don't have head support and you need it, you will find your head cannot comfortably rest on the floor. You'll feel that you have to tilt the head back excessively in order to reach the floor. And when you have too much of it, the head support, the excessive head support is going to push your head further forward and it's going to close off your airways, which is obviously the opposite of what we want. So you want to make sure you have head support if you need it, but not overdo it as to push your head further forward, closing off your airways. Hips too close or too far away from the wall. As the name of the 90-90 hip lift already suggests, we want 2 90-degree angles, 90 degrees in the knees and then 90 degrees in the hips. When you are too far away from the wall, you will not have a good lever to perform the pelvic tilt action. There are people that cannot tolerate 90 degrees of hip flexion. Then of course it is necessary to move out further, but you want to be as far away from the wall as necessary, as close to the 90-degree angle as possible. Not using support under their shoulders when you need it. So some of us can be so extended, ribs so flared, so hyperinflated that just lying with your shoulders flat on the ground is already putting you into so much extension that you have really no chance of getting a good exhalation. Meaning that no matter how hard you try to prolong that exhalation, your ribs are never coming down and your diaphragm cannot ascend. So in this case, we need to elevate the shoulders a little bit or a lot just to bring your rib cage and your diaphragm into a more advantageous position. If you need this extra shoulder elevation to bring your ribs into a more advantageous position and you're not using it, you'll be fighting a battle that you cannot win. Remember, all these techniques are really meant to put you into a parasympathetic state. So if you're in a position to begin with where you feel like you're fighting yourself, then you're not setting yourself up for success with the technique. This is a good point to maybe mention that when you have the setup just right, you should have an experience of rest. It shouldn't feel like you have to hold yourself up in some way. not setting the feet up in a way that gives you a balanced sense of your foot contacts. This can happen because either we're maybe not aware that we're supposed to have the full surface of the feet on the wall and to be able to sense them, or we could just have the feet a little bit too high or a little bit too low. In both scenarios, you will likely lose a sense of your heels. We want to feel the heels as well as the toes, and ideally we want to have a sense of the arches of the feet as well. Which, to be honest, if you're doing this barefoot, then it's going to be really hard to sense your arches. Generally, this will go better when you're wearing a good supportive shoe, which will give you a better arch sense. And we will likely do a video at some point in the future more on the topic of supportive shoes. Not using something underneath your feet when you should. The goal with the feet, besides sensing a balanced foot contact, in particular your heels, is to pull down on the wall so that we can recruit the hamstrings to help us tilt the pelvis posteriorly, meaning tailbone lengthening and slightly even going up toward the wall. This should happen on an exhalation, and when we're in that good pelvic tilt, we need to hold that position for the remainder of the technique. So it's pretty important to have a good setup that later allows you to find that good pelvic tilt. I personally find that most people have difficulty with pulling down on the wall when they don't have anything to pull into, such as a chair, a stool, a box of some kind. So whenever I teach a 90-90 hip lift in person to someone, I really almost always will put something underneath the heels so they have a resistance to pull into. The way you know whether you need something underneath the feet is if you can't really get an embodied experience of this pulling down action, or you cannot find your hamstring, or you'll find that you're slipping and sliding down on the wall. Moving on to the next category of mistakes, which is mistakes related to the action of the pelvic tilt. Once you are in a good setup, in the correct position, you want to pull with your feet down the wall or down into your box so that you can then curl your tailbone up, reach your knees up, and find a slight tilting action of your pelvis. If that goes well, you should feel some sensation in your hamstrings. Your back muscles should be totally relaxed. Your back should feel flat on the ground, and you shouldn't feel a hardening or tensing in your upper abdominals here, right underneath your breastbone. A common mistake here is to push the feet into the wall instead of pulling down on the wall. If you push your feet into the wall, you're going to feel the front of your thighs, aka your quads, instead of the back of your thighs, aka your hamstrings. You really want to pull down onto the box if you're using one, or down the wall like you're dragging the wall downwards. This pulling down action with your feet, together with a quality exhalation, which we'll talk about later, should allow your knees to travel up, tailbone to lengthen, your lower buttock area will lift ever so slightly off the ground, and as I mentioned before, lower back should feel flat on the ground. Another common mistake related to the action of the pelvic tilt is to not tilt the pelvis and to just lift the hips up, but staying in a forwardly tilted position. So you want to make sure that the lifting of your pelvis is a consequence of your feet pulling down action and your tailbone curling up action. It's not just lift the hips. Moving on to our next category of mistakes, which is exhalation-related mistakes. Getting the exhalation right really takes a lot of conscious, intentful practice. So let's talk about what constitutes a quality exhalation. In a quality exhalation, the diaphragm will move up, the ribs will deflate. We will sense the lower abs as well as the side of the abs. Your lower abs and side abs, so your transverse abdominals and your internal obliques, will help lift the front of the pelvis up and bring the ribs down. But here's the kicker: you cannot just tense your abs as an external artificial action, but rather the sensing of your abs should be an organic consequence of your exhalation. If you're exhaling long enough in a good position, you will feel your lower abs and your side abs. So a common mistake here is to prematurely tense the abs as an artificial external action instead of just exhaling long enough so that the abs will be sensed as a result of the exhalation and not as an artificial tensing up of these muscles. Exhaling too hard or using the wrong exhalation strategy. So very commonly, people will aggressively push the air out, and then they'll feel the upper abs here just below your breastbone hardening. Then the neck will lift off the ground, the lower abdomen might even bulge outward. And when you're exhaling in this way, your diaphragm is not ascending. Instead, when you get a good exhalation, the lower abdomen should feel like it's descending inward and backward toward the floor. Your ribs are coming down, and the upper abdominals underneath the breastbone should stay rather soft. Generally, a slower exhale will be better than an exhale where you're pushing out a lot of air at once. That's why often we will recommend using a straw to help prolong the exhalation without too much force. The next one is pretty obvious, exhaling incompletely. So when you're not exhaling long enough, your lower abdominals will not kick in, the side of your abs will not kick in, and most importantly, your diaphragm will not ascend. So we really need to prolong the exhalation long enough for all of those things to happen. The last one I want to mention in this category of exhalation-related mistakes is not relaxing, but overthinking and then therefore being too tense. We need to be able to relax in these techniques for them to work. And I'm aware of the irony here because we're analyzing this technique. We're taking it apart in this video. So yes, we need to analyze it to understand it. But when you're in the moment and you're doing the technique, you want to be as parasympathetic, you want to be as relaxed as possible. Moving on to our last category of mistakes, which are inhalation-related mistakes. Before we get to these inhalation-related mistakes, I want to make clear that a quality exhalation sets you up for a successful inhalation. So as long as you're still struggling with getting the exhale just right, don't even worry about fine-tuning your inhalation. If you cannot get the dome of the diaphragm, you cannot get the diaphragm to move up on the exhale, then guess what? You cannot inhale with your diaphragm. So this is the prerequisite. The diaphragm needs to go up first before then it can pull the air in and move down on the inhalation. Once you have a good exhalation, here's what we are looking for in a good inhale. The inhale should be quiet, no sound. It should be through the nose. And we want to maintain the position of the pelvis and the ribs that we have established earlier. We want to maintain a sense of our lower abdominals and our side abs. And then we want to feel the air move into the chest and then back right between the shoulder blades. The neck should remain relaxed. Here are the most common mistakes in this category. Inhaling too hard with too much effort and doing an audible inhale. Sometimes even it will sound like people are sniffing the air in when you're doing it, like so. And maybe you're able to see when you do it that way, you're gonna recruit your neck muscles to pull the air in, and then you lost everything that we've really worked so hard on establishing during the exhalation. So inhale should be quiet. Exhaling too much and then having a sort of panic response inhalation resulting from that. This happens because we feel like we need lots of air quickly. Our CO2 levels are so high because of this very prolonged exhalation that our body is kind of freaking out. While certainly we do want to work toward getting a more and more complete exhalation, in this scenario, it can be helpful to back off on the exhale as to not go into a panic mode, but rather than gradually over time with practice, extend the exhalation through graded exposure so that then we can, with time, tolerate a more exhaled state better without going into this panic mode and then consequently being able to have a quiet, calm inhalation. Losing the abdominal tone and breathing into the belly. If this happens, you need to work on maintaining your sense of closure of your bottom ribs and redirect the air into the rib cage. And then finally, the last one, I already touched upon it, losing the abdominal tone and then pulling the air in with the neck rather than expanding the rib cage. So again, same thing, you need to maintain your abdominal sense and then have a quiet inhalation so that you're not pulling your rib cage up. The last thing I want to mention is that there are, of course, people for whom 90-90 is not the right position to begin with, and we will make sure to make another video specifically about that at some point. But those are people that generally will feel pressure between their eyes or generally head pressure when lying on the back, or just people who don't feel safe lying on their back for a variety of reasons. So to summarize, there are 4 categories of mistakes in the 90-90 hip lift. 1 is setup mistakes. 2 is mistakes related to the action of tilting the pelvis. Number 3 is exhalation related mistakes. And number 4 is inhalation related mistakes. As you can see from this video, hopefully, there's a lot of nuance that goes into this technique and many reasons as to why you might not feel like you're unleashing the full effect of this very powerful technique. And I really hope that this video sheds some light on where you might have some work or refinement to do. Thank you for watching, and if you have any questions on the information discussed, please feel free to leave us a comment below and we'll help out as best as we can. Cheers!